What if I told you that the reason your period is irregular, your stomach keeps growing, your face is breaking out, and you are struggling to get pregnant may not be because you are eating too much? What if the real problem started years ago and nobody ever told you? Even more shocking is that some women spend years treating symptoms of PCOS without ever addressing the actual cause. So their weight keeps increasing, their periods remain irregular, their facial hair gets worse, and fertility becomes more difficult. Today, I'm going to reveal the real causes of PCOS in simple language, and trust me, one of these causes may be affecting you right now without you knowing it. Stay until the end because I will also share practical steps you can start today. For those meeting me for the first time, I'm Nurse Lilian, a registered nurse midwife with over 10 years of clinical practice, and welcome back to our PCOS series. Let's begin. What exactly causes PCOS? First, let me clear up a common misunderstanding. PCOS is not caused by one thing alone. It is usually a combination of factors working together. You think of PCOS like a tree. The symptoms you see: irregular periods, infertility, acne, facial hair, weight gain are the branches, but underneath the ground are the roots. Today we are going to uncover those roots. Now let's go to the causes. Cause number 1, insulin resistance. This is the biggest cause of PCOS in many women. Now, don't let the medical terms scare you. Insulin is a hormone that helps move sugar from your blood into the body cells where it can be used for energy. But in some women, the cells stop responding properly to insulin. This is called insulin resistance. As a result, the body produces more and more insulin. And here is where the problem starts. High insulin levels tell the ovaries to produce more male hormones called androgens. These extra hormones disrupt ovulation, and when ovulation is disrupted, periods becomes irregular. You may gain weight around the abdomen. You may develop acne on the face. You may notice unwanted facial hairs. You may struggle to get pregnant. If you constantly crave sugary foods, gain weight easily, feel tired after meals, or have dark patches around your neck, armpits, insulin resistance may be involved. Cause number 2, chronic inflammation. Many women have inflammation in their bodies without realizing it. Inflammation is the body's defense system, but when it stays active for a long time, it creates problems. Think of it as a small fire burning inside your body every day. That constant inflammation can stimulate the ovaries to produce more male hormones. This then worsens PCOS symptoms. Poor diet, excess sugar, lack of exercise, poor sleep, smoking, and stress can increase inflammation. Cause number 3, genetics. Have you noticed that some health conditions run in certain families? PCOS is one of them. If your mother, sister, aunt, or close female relative have PCOS, your risk may be higher. Now listen carefully. Genetics may load the gun, but lifestyle pulls the trigger. Just because PCOS runs in your family does not mean you are helpless. Your daily habits still matters. Cause number 4, hormonal imbalance. Hormones are chemical messengers. These hormones help control your menstrual cycle. In women with PCOS, the hormones responsible for ovulations become unbalanced. This then prevents the release of eggs from the ovaries. Without regular ovulation, periods become irregular. Some women may go months without menstruating, while others may experience very heavy periods when they finally come. Cause number 5, stress. This one surprises many women. Long-term stress affects hormones. When you are constantly worried, overwhelmed, exhausted, or emotionally drained, your body releases more cortisol, commonly known as stress hormone. High cortisol can worsen insulin resistance and hormonal imbalance. In simple terms, chronic stress can quietly fuel PCOS symptoms. Cause number 6, poor sleep. Many women underestimate sleep, but poor sleep affects almost every hormone in the body. Lack of quality sleep can increase hunger hormones, worsen insulin resistance, increase cravings, and contribute to weight gain. Even sleeping late consistently can negatively affect hormone balance. Your body heals during sleep. Without proper sleep, hormone recovery becomes difficult. How do these causes now show up as symptoms? With these causes, you may start experiencing irregular periods, missing periods, difficulty in getting pregnant, excess facial hair, acne, oily skin, weight gain, mostly around the abdomen, hair loss from the scalp, fatigue, mood swings, depression or anxiety, dark skin patches around the neck or underarm. And here is even something more important. You do not need to have every symptoms to have PCOS. Some women only have 2 or 3 symptoms. So what should you do if you suspect PCOS? First, don't panic. PCOS is manageable. Many women with PCOS go on to have their healthy pregnancies and live healthy lives. Step number 1, get properly evaluated. See a healthcare provider. You may need blood tests and an ultrasound. Step number 2, reduce sugar intake. Cut down on sugary drinks, sweets, and excessive processed foods. Step number 3, move your body daily. Even a 30-minute walk can help improve insulin sensitivity. Step number 4, prioritize your sleep. Aim for 7 to 9 hours of quality sleep. Aim for 7 to 9 hours of quality sleep. Step number 5, manage your stress. Prayer, relaxation, exercise. Prayer, relaxation, exercise, deep breathing, and spending time with supportive people can help. Step number 6, focus on whole foods. Eat more vegetables, fruits, beans, fish, eggs, nuts, and and healthy proteins. Step number 7, track your menstrual cycle. Changes in your cycle can provide important clues about your health. The biggest mistake many women make is that they focus only on the symptoms. They buy acne creams, they try weight loss teas, they hide facial hairs, but they never address the underlying causes. That is like mopping the floor while the tap is still running. That is like mopping the floor while the tap is still running. To truly improve PCOS, you must address the root causes. My final warning is this: please don't ignore PCOS symptoms. Untreated PCOS can increase the risk of infertility, diabetes, high blood pressure, heart diseases, and complications later in life. The earlier you act, the better your outcome. Your body has been sending signals. The question is, have you been listening? Now, I want you to hear. Now, I want to hear from you. Which symptoms surprised you the most? Do you struggle with irregular periods, weight gain, facial hair, acne, or fertility issues? Tell me in the comment section. Your story may help another woman. If this video helped you, please like, share, and subscribe. And don't forget to turn on the notification bell, because in part 3 of this PCOS series, I will reveal the foods that secretly worsen PCOS and the foods that help many women regain control of their hormones. Also type PCOS in the comment section if you would like my free PCOS recovery blueprint. Thank you for watching. I'm Nurse Lilian. See you in the next video.